Okay. So your case is suppose Salma, she is a 11 years age old girl. You have to do the CVS examination. You can start now.
Okay. I entered the room, wash my hand, and giving my sheet to the examiner, and introducing myself with Salma. And if parents is available, then hello, good morning. This is Dr. Roxana, one of child and adolescent doctors here. I'm meeting with Salma and your mom.
Yes.
Hello, thank you for coming.
Thank you.
Yeah, today I'm assigned, Salma, today I'm assigned to do your heart examination and also to check your pulse. Is it okay?
Okay.
Okay. So, Salma, which grade you read in?
She's submental. She can't give you the
Oh,
answer.
okay. Okay. No problem, Salma. So, I'm looking, is there any dysmorphic face
Yeah, there is a dysmorphic features present.
present?
Uh,
Um, yeah, is it the form of what about the depressed nasal bridge or puffiness of the face, or broad smiling,
yes,
smooth
big lip.
filter,
Yes,
thick
big
lip?
lip,
Okay,
thick lip.
okay, thank you. And is Salma is I'm looking for, is Salma is in any type of distress?
No, no any distress.
And in the room I'm checking for, is there any device, any medication?
No, there is no medication or device.
Okay. And what about her dimension? Is
Yes,
she
she's normal. She's actually some small, short proportionate.
okay? Okay, thank you. And now, Salma, I'm looking your hands, and here, can you do this side for me? And I'm looking for the clubbing by heart side.
Okay.
Yeah,
No
is
clubbing.
clubbing present? And
No clubbing.
in the hand, I'm looking for any. Is there any cyanosis?
No.
Any pallor?
No.
Any mm, osseous nodule or genuvulation?
No.
Okay. Salma, I'm feeling your pulse, and I'm feeling the radial pulse. What about the pulse rate and the volume?
Pulse actually 3D pulse.
Mm-hmm. 3D pulse. Okay.
Mm.
And Salma, and or I am asking mom, does any pain in her arm, hand?
No. No. No.
Okay, then I'm checking for the collapsing pulse by starting pushing the hand. And what's about, is the collapsing pulse is present?
No.
Okay, and then I'm checking, Salma, I'm checking your hand, another hand, and I'm doing the radio. Is there any radio radial delay?
No.
Okay, and now I'm looking in the hand for in the forearm, any cannulation mark
No.
in it? No. Okay, then in the axilla, I'm looking for axillary hair is present or not.
No.
Okay, and in the eye, Salma, can you do like this? And I'm
Yeah,
looking for the
she's
pallor.
doing.
Yeah,
No.
Salma, you are doing great. I must say
No.
that. Okay.
Okay.
And in the, can you open your mouth for me? And I'm looking for the oral hygiene cyanosis.
Actually, no. There is separated teeth you are seeing.
Yes.
Hygiene is
O-
okay.
Okay. Okay, Salma. And now I'm making the bed at the 45-degree angle and looking for the JVP. Is the JVP is raised? Salma,
No.
can you on the opposite side? Okay. And in the chest, I'm looking in the third dimension for any kind of distress, bulge, chest wall, any scar mark, any device.
Nothing but a scar mark is present on the midline sternotomy scar.
Okay. Okay. And is the scar is fresh looking or old looking? I'm looking for, it is fresh looking, and then I'm looking for the
Old,
scatenate.
old looking.
Old looking. Okay. uh, Salma, now I'm looking for, with maintaining the privacy, I am looking, I am putting my hand, and first I am
Mm,
warming the hand and
mm.
looking for the apex pit. I want to know the location of the apex pit. Is it in the right side or left side?
It is on left side. Okay.
Yeah,
and
and yeah,
it is forcible, I think.
forcible
Tapping.
and which space?
Fifth
Uh,
intercostal
fifth,
space, left fifth intercostal space.
left 50 intercostal space. Okay, and now I'm looking for the left peristernal hip. I'm putting my hand on here. Salma, is it okay? And I'm looking for the left peristernal hip. Is it palpable?
No,
Okay, then I'm putting my hand for palpable P2,
no,
and I'm putting my palp of the finger for any types any kind of thrill present in the four area: mitral area, tricuspid area, pulmonary area, and the aortic area. Is any thrill present?
no,
Okay. In the meantime, you are your effort is good, Salma. I must appreciate your effort. Okay, and there is no thrill. So yeah, Salma. I'm going to put this on your chest to hear how many sound your heart can make. And I'm putting is, and what about the heart sound? If S1 is S2 is audible,
no,
S1 S2 is not audible.
no.
Okay. And what is there any added sound murmur
Yes,
in all
murmur is
four areas?
present.
In
Yes,
which area?
murmur is
Yes,
second right
in
intercostal space.
yes. And then I want to see the radiation of the murmur and the neck area.
Yes, radiated.
Radiation is present. Salma, will you lean forward for me? And is it increase in inspiration?
Increase.
And can you hold your breath just like this?
Okay, she's holding.
And is the murmur is intensity is increased?
Increase.
Okay, that's it. Okay, and Salman, now I'm looking at the back of your chest for any murmur radiation
No,
or any. What about the added sound of the
no,
respiratory system? No. Okay, Salman, now I'm looking for your tummy. I'm looking for a. Is there any hepatomegaly?
no,
And now I'm looking for the edema.
no.
Okay, to complete my examination, I want to do anthropometry, measure blood pressure, want to do pubertal staging, oxygen saturation, and
And blood pressure.
and measure blood pressure, and want to do the developmental assessment and eye examination.
Okay, your examination was great, but that is when you go on the auscultation, your time is over. That is, or otherwise it works very systematic and nice. And you make repo, pain, ask, you warm your hand. You're doing great, or you can say that like good job, good job. I think it take less time. Good job, good job.
Okay.
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 So how can you investigate and management?
For
What
investigation,
What is the diagnosis?
my diagnosis is a case of maybe a case of Williams syndrome with aortic stenosis
Yes. And what is
with
your
operated.
yes, yes, operative median sternotomy scar. I tell
Yes,
you.
yes.
And what investigation and treatment you offer?
As she is 11 years old, so I will go through all of the previous investigation and report, and if needed, then I will do the ECG, where I may find the left ventricular hypertrophy, and also I want to do the echocardiography to and cardiac catheterization to know about the pressure gradient.
And what is the treatment?
Treatment, short term treatment, and the long term treatment. Short term treatment, if she has any exertional dyspnea, then we will manage it. And if the pressure gradient is more than 60, then
Hmm.
we can go for the cardiologist for valvoplasty. Or if it is failed, then balloon dilatation. If it is failed, then valvoplasty. And we also, in the long term management, we will also provide the cardiac advice, and also multidisciplinary team approach, cardiologist, our consultant, and social worker will be in
Okay.
our team.
And what is the complication of aortic stenosis?
Complication of aortic stenosis is maybe syncopal letter, sudden cardiac death,
Hmm. Chest
hypertension,
pain,
chest pain.
dizziness, chest pain, exercise intolerance. These are. And aortic stenosis associated with which syndrome
Turner syndrome, Williams syndrome, and
and
sometimes,
rheumatic fever?
yes,
Okay. And what is the indication for surgery?
surgery indication. Uh, Open surgery is needed if the balloon dilatation is failed or the pressure gradient is more than 60.
Okay. Suppose the patient develop heart failure. What are the feature you find?
In case of heart failure, on history there will be features of dyspnea, and
Hmm.
on examination there will be features of the both right heart failure, raised KVP, tender hepatomegaly edema, and the left heart failure, pulsus alternans, and also fine basal crepitation, tender hepatomegaly.
Gallop rhythm, tachycardia,
Oh,
tachypnea,
yes,
failure to thrive,
galloping.
cardiomegaly. These are we find basal crackles, edema. These we find. So how can you manage in case of heart failure?
So we will manage in airway breathing and the circulation, high flow oxygen, popped up position.
Hmm.
For removing the preload, we can give furosemide, and also with the consultation of cardiologist.
Hmm. So involve the multidisciplinary team, cardio,
Yes.
cardiothoracic, dietitian, intensivist. And we give the ABC, oxygen, high flow, educate nutrition, morphine, blood transfusion, correct the acidosis, hypoglycemia, electrolyte imbalance if present. Drugs we give, reduce the pre-up loop, diuretics, SC inhibitor, and enhance the contractility, inotropes. Everything with consultation. So, okay, that is, thank you for your participation.